Good afternoon. My name is Andrea Hall, and I will be presenting my IRB proposal, Vitamin D Deficiency and Depression. Vitamin D, also known as calciferol, is a fat-soluble vitamin necessary for the development of strong bones. Vitamin D also supports immune, brain, and nervous system health. Vitamin D is actually a steroid hormone that serves the purpose of a vitamin. There are two types of vitamin D, vitamin D2 and vitamin D3. Vitamin D2 is derived mostly from plants, and D3 is primarily derived from animal food sources. The body metabolizes vitamin D by two hydroxylation reactions. The hydroxylation reactions first take place in the liver. It begins with the 25 hydroxylase forming 25 hydroxyvitamin D, better known as 25-OHD. The second reaction takes place in the kidneys, where 1-alpha hydroxylase converts 25-OHD to a biologically active hormone known as calcitriol. Calcitriol is then transported to target organs where it regulates serum calcium and phosphate homeostasis, which in turn promotes development and maintenance of healthy bones. Vitamin D3 is absorbed through the melanin in the skin also from 7-dehydrocholesterol following exposure to ultraviolet B light. 15 to 30 minutes of sun exposure per day is optimal. However, most people do not get that much sun, and this could be due to time of year, use of sunscreen, type of clothing worn, what part of the country that you live in. In that instance, vitamin D, we need to obtain most of our vitamin D through our diet. Some good food sources for vitamin D are fish oil, fatty fish such as cod liver oil, swordfish, salmon, sardines. Some foods are fortified with vitamin D, such as milk, yogurt, and some breakfast cereals. And that just means that they add vitamin D in the process of making these products. There are very few vegetables that contain vitamin D. Mushrooms that are grown in light happen to be one particular one that does contain vitamin D. Vitamin D is metabolized into calcitriol in the intestines, and then calcitriol is used by the intestines to absorb calcium, and this is critical to bone mineralization. Vitamin D deficiency can cause severe medical conditions, and it has been linked to autoimmune diseases, cancer, cardiovascular disease, and diabetes. Deficiency has also been associated with childhood rickets and adult osteomalacia, which affects the bones. Vitamin D deficiency is a worldwide health epidemic, and there are factors that can influence our synthesis of vitamin D, which could be your age, the season, the latitude, time of day, use of sunscreen, amount of skin that is exposed to the sunlight. Those are some things that can determine how much vitamin D is synthesized. Women ages 45 to 60, their daily recommended intake of vitamin D is 600 international units per day. And the optimum vitamin D level for adults should be over 25 nanograms per milliliter. Toxicity can occur, however, it's not common, but that just means there's a buildup of calcium in the blood. Some symptoms of this toxicity could include diarrhea, constipation, nausea, and vomiting. If there is a significant buildup of calcium, kidney stones could be formed. Recent research has shown a link between vitamin D deficiency and high levels of depressive symptoms. And depression is a growing area of mental health disease in our country. And women tend to report more depressive symptoms than men. Depression is also considered a worldwide epidemic by the World Health Organization. approximately 350 million people around the world suffer from depression each year. What causes that? Well, environmental, psychological, genetic, biological. Those are all factors that are suspected to cause depression. And recent research has actually added nutrition deficiency as a cause also associated with depression. One area of nutrient deficiency that's being studied and researched or reviewed is vitamin D deficiency. According to Brower and Bromslud, the existence of vitamin D receptors in the brain points to vitamin D's role in brain function. Several areas of the brain have vitamin D receptors that are related to our emotions and mood, such as the hippocampus and the hypothalamus. Research is being done as to how vitamin D affects those areas of the brain. Vitamin D, or serum 25-hydroxyvitamin D deficiency, is defined as less than 25 nanograms per milliliter. Vitamin D deficiency has been shown to have effects on blood pressure, blood sugar control, kidney disease, mood disorders such as anxiety and depression. Sefernameshe conducted a randomized controlled trial on the effects of vitamin D supplementation on patients with major depressive disorder. They were randomly assigned to either a group receiving a supplement or a group receiving a placebo. And for 8 weeks, that they received that intervention. Their fasting blood samples were taken at the beginning of the study and then after 8 weeks of the study. They used the Beck Depression Inventory to assess the level of depression, and after 8 weeks of vitamin D supplementation, the Beck Depression Inventory scores had significantly decreased. In several systematic paper review papers, the authors concluded that it was clear that vitamin D deficiency is associated with an increased risk of developing depression, and that vitamin D supplementation in the right dose could be comparable to the effects of using an antidepressant medication, which shows or could show that vitamin D supplementation would be a great alternative for treating depression. The majority of the studies reviewed did find a significant positive correlation between vitamin D supplementation and improvement in depression. Those levels of depression were determined by different types of scales, such as the Beck Depression Inventory Scale. However, it was concluded that more randomized control trials were needed to determine if vitamin D deficiency causes depression, or does depression lend itself to lower vitamin D serum levels. The hypothesis for this study is, can vitamin D supplementation positively affect depressive symptoms in women aged 45 to 60 years of age as measured by the Beck Depression Inventory? The null hypothesis for this study is that vitamin D supplementation will not have a positive impact on depressive symptoms in women aged 45 to 60 suffering from vitamin D deficiency. This type of study will be a quasi-experimental, non-randomized pre-post-test intervention design. There will be one group that will receive 15,000 units of vitamin D3 daily for 8 weeks. The Beck Depression Inventory will be used to determine the level of depression. The vitamin D level and the Beck Depression Inventory scores will be obtained at the beginning of the study and then again at the end and conclusion of the study at 8 weeks. The subjects will be recruited through 2 local psychiatric clinics. The clinics are located in a large suburb outside of Dallas, Texas. And the women aged 45 to 60 who are being treated for depression by therapy only will be included in the study. The study will take place in January and February, as it is posed that the winter months people show lower vitamin D levels in the winter months. The principles of the Belmont report will be followed. Once subjects have been approved and committed to the plan to the study for participation, then an informed consent process will begin. A information sheet with all the study facts and with the purpose and the process and how data will be used will be given to each participant. For the data analysis, a G-Power test was run, and it was determined that a sample size of 47 would be adequate. We rounded up to 60 for possible attrition. A paired t-test will be used, and the statistical package for social sciences is the software that will be used to analyze this data. The level of significance is P is less than 0.05. If P is less than 0.05, we must reject our null hypothesis. Before treatment, vitamin D levels and the level of depressive symptoms are going to be compared to the after treatment levels. Demographics also will be compared. We will look at age, ethnicity, education, and socioeconomic status to determine if that has any impact or if there's any relation between that and vitamin D deficiency and depressive symptoms. Some of the limitations for this study would be that the sample size is small and it's only studying women. So that might make the results hard to generalize to the public at large. The recruitment of participants from psychiatric clinics could also present a problem because those people are already actively seeking treatment for depression, so they may be more motivated to stay within the protocol of the study, and this could affect their results. The study length is relatively short at 8 weeks. There are some studies that have gone over 2 years. One of the factors that cannot be controlled would be if participants decide to travel to a warmer climate or just a different climate during those months, since they are winter months. This could skew the results one way or the other, and we would not be able to determine if they have done that or not. Also, participants' compliance with the daily supplementation regimen. There may be some people who do not hold to that protocol, which could also have an effect on results. With the growing epidemic of vitamin D deficiency and depression, it is necessary for us to explore all the avenues of treatment and improvement for these disorders. The widespread vitamin D deficiency among middle-aged women is a crucial health issue that needs to be alleviated. And this age group is also one of the age groups that present with the highest depressive symptoms. Women who are at risk of postmenopausal osteoporosis due to vitamin D deficiency are affected by this. And research shows that depression is the leading cause of disability among women. Using vitamin D supplementation as a treatment would be a cost-effective, inexpensive way to treat depression symptoms. And there are also very few side effects to vitamin D supplementation. Connections between vitamin D levels, depression, and obesity is another area that's currently being researched. However, it's also that case of, does depression cause obesity or does obesity cause depression, which is a factor that researchers have to look at. Rising medical costs each year due to the treatment of depression and chronic disease is putting a burden on, on our society. So it would be our future clinical trials are necessary to help possibly alleviate some of those costs, and would be, provide evidence of supplementation improving mood and other health outcomes, which could be translated into clinical practice use, which typically not many clinical practices use supplementation in their treatment plans. Thank you for listening. I hope you have enjoyed this presentation.